Hello, and welcome everyone to this live roundtable discussion to wrap up Connected 2025. Over the past week, we've explored a critical truth. Obesity does not exist in isolation. We have learned how obesity is a complex chronic disease that is connected to other important conditions, such as, but not limited to, diabetes, as well as sleep, cardiovascular, and liver health. But here's the problem. Our healthcare system most often treats those downstream conditions first, ignoring obesity until it's too late. So imagine if we flip that approach. Imagine if we treated obesity first as the upstream factor that fuels so many other illnesses. Or better yet, treated metabolic concerns as a preventative medicine, helping to stop obesity in its tracks and other related conditions from occurring altogether. At a minimum, wouldn't it be great to see more collaboration across disciplines to treat obesity and its related conditions concurrently, leading to a better overall health and holistic tailored approach for each individual human? Think about it. How much suffering could we prevent? How many lives could we improve? How much money could we save in healthcare costs? Today's conversation is about courage. The courage to change the system, the courage to shift the way we think about treatment, and the courage to demand better care. That's why today we've gathered four incredible voices to help us answer the biggest question. How do we take this momentum and turn it into national action? Before I share a few housekeeping items and then jump into today's discussion, I'd like to take a moment to introduce myself. My name is Lauren Gates. I'm a member of the OC Connect community living in Calgary, Alberta. As someone with personal connection to obesity, I'm honored to host this week's conference. It's truly been a privilege. My goal is to help bridge the gap between lived experience with professional practice, fostering a more compassionate healthcare environment for those living with obesity and its related conditions. I hope that the discussions that you heard throughout this week have inspired greater empathy, deeper understanding, and will lead to more effective patient care. If you haven't yet watched this week's sessions, you can access the recordings at your convenience by clicking on the on-demand video section. Today's conversation is being recorded and will be posted there as well. For a bit of housekeeping, for your best experience, please make sure you're logging in today using Chrome as your browser. If you've experienced any technical issues during the event, you can email support@kingevents.ca for help, or you can message in the live chat with the support agents by clicking help in the top right corner of your screen. You'll notice a chat window beside me to the right of the screen. You can use this to ask questions for the panel throughout the session and participate in polls. We would like to take a moment as well to thank our sponsors for this conference who have made this week Connected 2025 possible. Thank you to Shoppers Drug Mart, Pfizer, Novo Nordisk, Boehringer Ingelheim, and Johnson & Johnson, and Regeneron. Okay, so I'm excited to introduce our impressive lineup of caring and super smart panelists for today's discussion. Lisa Schaefer is the Executive Director of Obesity Canada and a dedicated advocate for improving obesity care and reducing weight bias. As a leader with lived experience, she works to amplify patient voices, drive policy change, and improve access to evidence-based care across Canada. Lisa is passionate about breaking down stigma and ensuring obesity is treated as a chronic disease with the same urgency and compassion as any other health condition. Dr. Sanjeev Sokalingam is the scientific director of Obesity Canada and the professor of psychiatry at the University of Toronto. He is also the psychosocial director for the UHN Bariatric Surgery Program and chief medical officer at the Centre for Addiction and Mental Health. A leader in obesity and mental health, he has authored more than 250 publications, co-authored the 2020 Canadian Adult Obesity Guidelines, and led clinical trials on virtual psychological treatments for obesity. He also co-edited 2 books on mental health in obesity care. Dr. Megha Prodder is a Canadian endocrinologist and obesity medicine specialist and medical director of the Medical Weight Management Centre of Canada. She is also an assistant clinical professor adjunct at McMaster University and a diplomat of the American Board of Obesity Medicine. Dr. Prodder has played a key role in developing obesity education materials, contributing to both the McMaster Test Book of Internal Medicine and the Canadian Adult Obesity Clinical Practice Guidelines. As a principal investigator, her research focuses on obesity and type 2 diabetes, and she has helped shape the global ICHOM patient-reported outcome dataset for obesity. Beyond research, Dr. Potter is a dedicated mentor, training healthcare providers in comprehensive patient-centered obesity care, both nationally and internationally. Ian Patton is the Director of Advocacy and Public Engagement at Obesity Canada, combining his academic experience and lived experience to drive change in obesity care. He holds a PhD in kinesiology from Western University and completed a postdoctoral fellowship at the University of Toronto with research focused on BMI, obesity, and childhood physical activity. As a bariatric surgery patient and a national advocate, Ian works to eliminate weight bias and improve access to care for individuals living with obesity. So let's welcome everyone to the stage. Thank you all for being a part of this important conversation.
Love it. Thank you.
Thanks for having us.
Of course. So Lisa, I understand that Obesity Canada has released a shiny new manifesto. Would you mind reading it to us, please? I really found it impactful, and I'd love to start us off with that.
Thank you. I think it is a fantastic way to start the day as well. And I just want to say thank you for a second as well and say, Lauren, you've been doing a fantastic job in leading these conversations this week and really teeing us up for this big one today, where we're really going to talk about all these things and try and bring it all together. I hope everybody also is getting a different sense of a little bit of how Obesity Canada is going to be showing up, not just in our visuals, but in our language. And that's really rooted in the manifesto that I'm going to share with us, because really the moment we're at is that we realize that the challenge really is bigger than obesity, but so is the opportunity for change. And that's what I'm really excited about talking about today as well. But it's true, because this really is bigger than obesity. Obesity isn't just one person's challenge, it's all of ours. It is a complex chronic disease influenced by biology, environment, and the systems we live in. For too long, obesity has been misunderstood, simplified, and stigmatized, creating walls where bridges should be. We refuse to accept the status quo. Obesity Canada is building a different future for the millions of Canadians living with obesity, a future where our collective mindset shifts from judgment to understanding, from outdated stereotypes to science-backed solutions, and from isolation to action. We know that powerful change comes from making connections. When research meets action, when education inspires change, and when advocacy amplifies voices, we change lives. We fight for policies that reflect reality, not misconceptions. We amplify voices and drive education that inspire empathy and empowers change. Most importantly, we lead with courage, a courage to build a Canada where health is not defined by size, but by the freedom to thrive. We also know that this isn't a simple journey, but it is one absolutely worth taking. So we are calling on policymakers, healthcare providers, and everyday Canadians to join us, to challenge bias, break down barriers, and rewrite the narrative on obesity. Obesity is bigger than what meets the eye. So let's think bigger, let's act bigger, and let's see obesity for what it really is. And let's see people for who they really are. Because this is progress, this is connection, and this is bigger than obesity. And that's what we've been trying to get everybody to join us and understand this weekend, that you're doing such a beautiful job with as well, Lauren. So I'm excited. I'm happy to share that manifesto. And I hope it gave chills to everyone, much like I know that you felt.
Yeah, even hearing it again, I feel chills. It resonates with me so much as a patient advocate, as someone who is a patient in this space. And just thank you so much for everything that you're doing in your new role. I couldn't be more delighted that it's you.
I still get goosies every day that I get to say that I am the executive director of this organization. So thank you.
It's amazing. Okay, so let's start off today's conversation by hearing from our audience. So let's talk a little bit about courage in action. So courage takes many forms. So I'm wondering if you could please think about a time in your own life when you had to push forward, even when it was hard. What did courage look like for you? Here's a few options for the poll: asking for help in a healthcare setting, challenging bias or misinformation, advocating for better care, maybe changing your own thinking, or maybe something else completely unrelated to obesity and the disease of obesity in healthcare. Let's hear from you. Challenging bias or misinformation, changing my own thinking, advocating for better care, Absolutely. Absolutely. Yeah, couldn't agree more. Beautiful. Well, thank you so much for participating in that. So I think it's important to look at these questions and how important these answers are, because this is what courage looks like. It's personal, but it's also collective. And collective courage is what we need to drive real change in obesity care. So I want to turn to our panelists now, because changing systems, policies, and mindsets takes immense courage. I want to know what courage looks like for them in this fight. So Lisa, let's start with you. As an advocate, how have you seen courage play a role in changing how we treat obesity?
Oof. It's fundamental, I think. I often say you can't be what you don't see. And it takes courage to be vulnerable. Takes a lot of courage to stand up and share your story as an advocate and help people connect those dots. We have to sometimes share the most vulnerable parts of ourselves, but I think it is so foundational for people being able to connect and understand what we're talking about in a very deeply personal way. We know that 1 in 3 Canadians is living with overweight or obesity, which means truly, I don't think anyone can say that they don't know somebody or that they aren't personally affected on some level. So I think if we can help that land with people, people will get on the right side of things.
Yeah, you bet. It took a lot of courage for me to do this week and even attach
Yeah,
my
it
name to
did.
the word, right? Like, it's kind of
Yeah,
a tricky word. It has so much stigma, but hey, the cause is more important than my ego. So there we go.
I love it. I
Um,
love it.
Sanjeev, curious, from a medical perspective, what does it take to challenge outdated treatment models?
Well, I think, first of all, when we think about courage and challenging outdated treatment models, we've got to start with patients and people living with obesity first. I think, when I see patients in my clinic, or I'm thinking about even broader program or system change, it's important for us to recognize what people living with obesity have had to endure in healthcare contexts and our current system right now. And, the amounts of stigma, which are highly related to the experiences that they have with healthcare providers. And so courage in challenging these outdated treatment models within our system really are dependent on the courage to admit that we have done poorly in caring for people who are living for obesity. So that's the first thing. And secondly, the courage to unlearn what we thought we learned for decades. Because as a system and healthcare providers, we have been taught things that are outdated myths influenced by society. We are no different or invincible than anyone else in the healthcare system, in society. And so I would say, as medical professionals, we have to own up to that piece and have the courage to say that. And then lastly is the courage, similar to what Lisa said, which is to speak up, right? To have the courage to speak up with, not on behalf, with our patients and families in the context of living with obesity. And so what does that mean? That means when you hear a colleague or a healthcare leader in your context, making comments that obesity is a lifestyle choice and we shouldn't be diverting resources to support comprehensive or integrated obesity programs, we should speak up to say that's not okay, right? And make those parallels to other chronic diseases. We should also be speaking up to say that we have learned a lot from science, but we need to be pouring in more dollars to understand the science and evidence of obesity. So that's, our research programs nationally should be really looking forward to this. And lastly, speaking up from a public health standpoint and really coming forward to say we need to really do a lot more advocacy as healthcare providers to make meaningful system change.
I love that. It's like the Maya Angelou, when you know better, do better. It's
That's
okay.
right.
Maybe you didn't know. We all grew up in the same world with the same silly magazines and silly commercials and silly movie things. But when you know better, do better. And yeah, I love that. Okay, so Mega, as a frontline provider talking about courage, how do your patients demonstrate courage in seeking care?
Oh, I love that question. I would say I'm remarkably surprised at my patients' ability to be resilient day after day. Often, the story by the time they get to me as an endocrinologist and obesity medicine specialist is they've had so many negative experiences within the healthcare system already. And it always shocks me that they're willing to come meet a new doctor, sit in my office. They don't know who I am or what I'm going to say, but that courage and that resilience is remarkable. And it's so interesting to share it right back with them. So if I lend a hand of support, I just see that barrier melt away right away. It's like they've built up this huge barrier to protect themselves because they have to. The system has constantly been against them. And when they finally meet somebody who's on their side and supportive, you just sort of see that melt away. So I cannot thank my patients enough to show me what courage really means. It's remarkable to go through treatments. It's remarkable to struggle and be told that it's your fault over and over and over again, and yet to come back. It's an incredible thing that I think people living with obesity have that in other disease states don't really have that same or need to have that same type of resistance. And the other thing I'll say is, as healthcare providers and patients are partners in this journey, it's our job to make sure that we're offering a supportive and open environment for when things are not going well, right? Because there's always these ups and downs in the journey, and I just want to make sure that I'm giving my patients the space to have courage when they're not feeling so great, when they're not doing so well. Everyone wants their doctor to be proud of them and show up when things are going well, but I don't need to see you when things are going well. I want to see you when things are not going well. So, I find that the way that we're defining courage is changing, but that's just because the treatment landscape has changed, and what we can offer is really remarkably different.
Absolutely. After so many times being told it's just eat less, move more, it's your fault, you should be able to get this under control. Losing weight, gaining weight back, like patients with living with obesity definitely have a lot of grit. And I can imagine it's probably a little bit emotional when they get met with something different when they meet with you. So, thank you from all of us. That's amazing. So Ian, as someone living with a lived experience with obesity, what's it like to navigate a system that still doesn't fully recognize obesity as a disease? So still talking about courage.
Yeah, it's an interesting question. And reflecting on my own experience, I came at this from a relatively privileged position. I was, educated in obesity science. I was part of an organization where I got to work with some, incredibly smart people that work in this space. So I had a lot of ammunition when I was trying to navigate the system and asking for the care that I needed. I had, science behind me. I had, evidence that I could point to, and I knew what I needed and what I wanted, and it made it a little bit easier for me. So, I don't look back on that and think about courage in my own experience, but in the 10 years since then, I've been involved in community building and working with people here with our OC Connect community. And I get emails every single week from people who are trying to do just this, navigating the system. And, like we already mentioned, a lot of that is negative experiences. People going in and they have a long history of having pretty negative experiences and not wanting to be around healthcare. There's a lot of healthcare avoidance. So I think when we're thinking about courage and how to navigate this system, I think we need a few things. First and foremost, as people living with obesity, we need forgiveness. We need to have a little bit of an open door to rebuild those relationships with our healthcare providers, with the healthcare system. I would go even further and say that we need to open the door to forgiveness to society and the people that are around us in our lives that have, added to some of that stigma and bias. We need patience. So we have to realize that change is slow and none of this is going to happen overnight. So we need to be persistent. We need to be able to go into these appointments with our doctors, ask the questions. And if we don't get the right answer right away, we can do it again, or we can do it with another doctor. We have to have a little bit of patience. And then finally, I think we need to have trust. And I think we need to trust that we're on the right side of this. We've been talking about obesity as a chronic disease. It is a chronic disease. That change is happening. We are kicking those doors in. Like I said, it's going to take some time, but trust that you're on the right side of it. Arm yourself with some good information, with some evidence-based information that you can use to help you with those conversations, and just trust that the change is coming.
Absolutely. Gosh, you're reminding me of the conversation that we had with Lindsay about diabetes and the grief that comes with being diagnosed with a chronic disease and being met with difficult experiences throughout your life and with the healthcare system. And I know that's how you and I met. I mean, coming into this space with a lot of healthcare avoidance, some rage, and some grief. So OC Connect has been a really welcoming space, and I recommend it to anyone. Okay, so love that. So we've established that courage is necessary. So let's now talk about why this moment is different. So the paradigm shift in obesity care is happening. It's no longer a debate. Obesity is a complex and chronic disease. So today we have a better understanding of the science of obesity than ever before, and that continues to evolve. We have more treatment options than ever. We have more people talking about obesity, but we need to act now as a collective and really lean into the current momentum to see the changes in obesity care and policy that need to happen. So we're going to have a conversation about treating obesity first with our panelists. So we've spent the week discussing the intersections of obesity and other chronic diseases. But I'm wondering, what happens if we stop treating obesity like an afterthought? What if we made obesity a first-line priority in healthcare? What if we treated it as an upstream driver of diabetes and issues with sleep and cardiovascular and liver health instead of waiting for complications to arise? What if we treated it collaboratively and concurrently while treating other conditions and supporting the whole health and well-being of the people seeking care? So let's talk about it. What's driving this paradigm shift? Sanjeev, start with you. Let's talk about the maybe what are you seeing in terms of the progression of science and the evolution of treatment guidelines here?
Well, Lauren, thanks. I mean, that is a exciting opportunity, and we are in an exciting time right now. We've seen a real surge in both, I think, the uptake of science that we've had before about obesity being a chronic disease, but also the complexity of obesity as a disease in terms of the neurobiology and the neuroscience and our understanding that surprise, surprise, our brains are not disconnected from the rest of our body and that they influence obesity in such meaningful ways in people's lives. We also know about all the complexities of our environment and genetics, which are all the factors. But in the keeping with the theme of this week, which is about intersections and all the physical health conditions that might be associated with this, it is really in keeping with the fact of the science right now that we are seeing that once you start to treat obesity, that surprise, surprise again, that you end up seeing improvements in all of the other obesity related complications, right? We had talks earlier this week about sleep and diabetes and impacts on fatty liver disease. And so, you know, as part of our science and the research trials, we are moving way beyond weight now, like weight and body mass index. And we are looking at a holistic model of care, right? Our treatments across our three pillars of psychological, medications, and surgical have now shown kind of and continue to grow to show that we know for years that obesity has been linked to so many health conditions, so many parts of our overall health, and that if we can start to treat this effectively, that we will see reductions in many of these areas. And again, it all starts with obesity as a chronic disease, that there's a biology, but not to ignore the psychology and environmental and psychosocial components. And that if we treat this in a holistic way, we can actually have meaningful outcomes in terms of health. And probably the most important thing when I hear in my clinic every day is the impact on patients' quality of life and how we can really, it can be liberating for people who have been, you know, unable to navigate, find, or access treatment. And that to me is probably the most rewarding part of being in this field right at this time.
Amazing, amazing. It boggles my mind. Like of course, everything is connected. Our whole body is connected. None of our organs operate in silo. So just makes sense. So Lisa, the science has been clear for years. So what's shifting now is the public and policy awareness that we keep. Sorry, what's shifting now is the policy and public awareness. So can we talk a little bit about what we see shifting and the good, the bad, the ugly, all the things that you're noticing?
As Sanjeev said, it is such an exciting and interesting time. I think for our academic friends and our clinical friends to be in this space, but I think it's also a really interesting and exciting time as somebody with lived experience or someone navigating this moment. Things are getting very loud, which is good and bad. We know it's very noisy. Diet culture has always been noisy, but what's interesting is we're seeing all these stories now of people who have received treatment, and people can see the results. Now, that's not always, the best situation, because as we've been saying for a long time, BMI tells me your size. It doesn't tell me how sick you are. It's not a reflection of health. So we're still connecting a little bit of the dot of weight loss to health, which is something we'll uncouple, but we'll take the win today, because what's happening is it's becoming undeniable that there is something very scientific about this moment. It's not just about, calories in, calories out. Something is intervening now in a way with more people that is showing that this is an important moment and that it's worth investing in as well. So I think that's something that's changing. It's in that social ether, and we'll take the win. As I said, we've got comics making jokes. Not always great, but it's at least introducing the conversation. And I think in some ways it's like giving us all a little bit of push to be able to have the conversations. And that helps us in that courage bucket as well. I always say people are entitled to their own opinions, but not their own facts. So the joy of this moment is let's make those facts louder, clearer, and easier for people to understand as well, because then they'll join us.
Absolutely. Ian or Mega, do you have anything that you want to add to those thoughts?
Sure. I'd love to just add the reality of the advancement in obesity is that it has made it easier for us to treat. So let's be honest, as healthcare providers, there's lots of barriers and lots of limitations to treating. But when the narrative starts to change to say, yes, obesity is a chronic disease, prior to the last, let's say, 5 to 6 years, we said obesity is a chronic disease, but what do we do about it? And now we're saying obesity is a chronic disease, and we have access to safe and effective treatment for the first time. That has hugely changed the paradigm, because now we can do something and we see the outcome of that treatment right before our eyes. It doesn't matter whether you're a hepatologist or a sleep doc or a cardiovascular surgeon, you're seeing the outcomes of these treatments. And so I think now clinicians are getting just as excited as patients are, because we can finally do something. And so, that is where I really think we've now shifted the paradigm to, we want to get on board with this because it works and it's effective and we see the outcome of it.
Mm-hmm.
Yeah,
absolutely.
Ian,
not to put you on the spot, but you talk to a lot of patients. So
yeah, I was just going to say, one of the big drivers of this paradigm shift is the patients themselves, the community members. I mean, like I said, I've been around as an advocate for the last 10 years. And in that time, I've seen, community groups and patient support groups and things like that become very, very active and engaged. And there's more of us that are out there that are, driving this change and demanding more and getting involved in organizations like Obesity Canada and those sorts of things. So there is a driver there that is the people themselves that are living with this disease. I think that's really, really powerful from the ground up.
Love that. Okay, next question. Wondering, what do you all see as the biggest barrier to shifting how we treat obesity today? Mega, let's start with you.
Yeah, I mean, I think that there's always going to be barriers when we're in a state of transition and change, right? So there's barriers kind of at every level, whether it's comfort and ease of training and being able to treat the disease, whether it's access to treatment. We still know, for example, medications are quite expensive, and we're having to continue to push the needle in terms of improving access to those treatments. We also know long-term support for obesity is poor. In general, patients are going through programs that are short-lived, and this is a chronic disease, so they're often left without, that long-term kind of hand-holding that's required for other chronic disease states. So I think there is room to improve in terms of what we're actually doing and to knock these barriers down. But to come back to that holistic idea that this is a chronic disease, our healthcare system is set up to treat chronic diseases. This is not new. We do this every single day. There's no reason why we can't have the same standards, the same outcomes, the same clinical practice guidelines in a system that already does this kind of work. So for me, these are barriers, but they're almost superficial barriers. They are achievable and we can overcome them. It's just about being creative and thinking a little bit more broadly. And I'll sort of go back to that point is when we have treatment, we see that everything else gets easier. And so, what's going to be the push to change that outcome? It's going to be the treatment itself.
Some call them barriers, some call them opportunities. Love
Exactly.
it. So Ian, over to you. What are your thoughts on this question?
Yeah, I think one of the biggest barriers has to be stigma in healthcare and in policy. And so, we've talked about, some of the experiences that people have in healthcare, and that's one of the elements there. And I'll come back to that. But, looking back at policy and like how the system's even set up and how these things, if we're talking about access to treatments, how that comes down. So, the health technology assessments, going all the way back to that, where they're deciding whether a treatment is going to be covered or not under the government plans and those sorts of things. Private insurance takes their lead from that. So if there's a barrier downstream, that far downstream, then that needs to be addressed so that we can kind of get the snowball rolling downhill and start making things happen a little bit better there. So I think there's definitely some barriers that are rooted in stigma that go as far back as those types of assessments, even into the research and the clinical research that's being done and the stuff that's being measured in those trials so that we have the data that can help drive those policy changes. And so addressing that is going to be definitely key. When we're talking about in the healthcare system and how people are experiencing stigma in the healthcare system, I think it really comes down to simple, basic, respectful human communication. And I don't think that that's a hard thing to do. That's such a low-hanging fruit. We can treat each other like decent human beings. So we can address the stigma in healthcare today, right now, just by being decent people to each other and having open lines of communication.
Mm-hmm. And there's such a risk with the internalized bias as well, for folks living in larger bodies, like the shame and blame that they feel. And, the first step to them perhaps engaging and really believing in treatment or kind of giving it that last college try, if you will, is maybe unpacking a little bit of the feelings around like, this isn't your fault, as well. And I think there's been an interesting dialogue in kind of the social media space around folks saying, with a lot of GLP-1s and stuff, it's like, oh, maybe the world is now going to be a place where there aren't any people like me anymore. And what if this medicine doesn't work for me? So just really interesting conversations where we can have compassionate discussions with patients. So anyway, I digress. Sanjeev, what are your thoughts on the biggest barriers that we see shifting, the biggest barriers that we're seeing right now and what's shifting?
Well, I'd like to say that picking up on your last point, actually, you didn't digress. It was actually spot on. I do think there are a few components. Like I think one, that internalized weight stigma and bias is really a huge component. And all of us have talked about how difficult it is for people living with obesity who've unfortunately had to endure so much in terms of the struggles and those failed communications in healthcare and other societal contexts. And for us, it's to rebuild trust with people living with obesity. For me, it's with my patients, to be able to say that, validate those experiences, those real experiences, that have been repeated over the course of time, to be able to understand how I can be of best help to those individuals who might be internalizing, who might be coming forward. And this might be their one moment that they're coming forward to speak again after years or repeated encounters that have been stigmatizing. And then the third component is really to try to help people get help. And so we've talked about obesity treatment, and we're talking about the new science and medications. It also means the compassion and healing that people need for some of the emotional components as well. And of course, as a psychiatrist, I would take it down the mental health path, and I'm going to do that. But I do think that is a core component to comprehensive obesity care. And it doesn't mean that everyone needs a psychiatrist or psychologist. Every healthcare provider has the capacity to do some of this work. And so how can we build that within comprehensive obesity management so that we can remove this barrier for the individuals who have had to endure and be so resilient, as Mega talked about, for coming forward in these clinical contexts?
Yeah, there's been some really good work recently in training frontline healthcare professionals on those conversations. I think there was some great information that we released around asking permission, but then as a follow-up to asking permission, there's a little bit more guidance. So Mega, not to put you on the spot, but what if you want to maybe mention a little bit about that? I think it's some good news. So
Yeah, for sure. I think often we talk about addressing obesity as a chronic, complex, progressive disease, and then we sort of say, okay, now go do it. And we don't really give any practical advice on how to move the needle and sort of step forward. But there's a very sort of clear algorithm in the clinical practice guidelines that helps just to introduce these ideas. The idea is that not everyone is ready to speak about obesity or their weight or what they're having difficulty with in the moment. And so it's pretty critical to establish that relationship by asking permission. It just opens up the conversation to say, I'm here to help support you if and when you need it, but you don't have to feel forced or like I'm telling you to do something. This is not a top-down conversation. It's really to say, I'm happy to help you with your weight if that's something that you're struggling with. Do you want to have a conversation? And it's so interesting to see how that dynamic, by just opening the conversation that way, just dramatically changes the story. The patient's ability to share their story and their narrative, get their guard down. You can imagine as a healthcare provider, that top-down sort of approach is very, do this, you're going to struggle with health conditions if you don't do this. That has never worked. And so, at the end of the day, what has resulted is, oh, well, the patient didn't want to do it, but actually, perhaps it's the way that we're approaching the conversation. We're not inviting a real conversation. We're just telling information, and that's never going to be as effective as sharing the story. So, the 5 A's is sort of the tool that we use in the clinical practice guidelines to open up that conversation. But then there's really interesting education and training on how to close the conversation too. And that's a really, what we've learned is we taught people how to open the conversation, and then all of a sudden they don't have time to close it and they're feeling rushed and that they can't do this or do justice to their patients. But there is materials and training to even learn how do you bring it back home so that both you and the patient has gotten the best out of you that you can out of 10 minutes. It doesn't take long. We're able to kind of break down internalized bias, for example, in 10 minutes. So, there are lots of training materials and learning that we can do to really help those that in need in greater detail.
amazing. I love it. 10 minutes is not a long time, but there's a lot that can be done in 10 minutes, and it doesn't have to be just one conversation. Lisa, what are your thoughts on all of this? Curious.
I love everything that I'm hearing, and I think it is completely true. But that also reminds me, this is big. This is complicated, and this isn't easy, as we said in our manifesto as well. And I've been describing this as like a tangled ball of lights for a while now as well. So that barrier still exists. There's still a lot that we need to unpick. But what I love is this spirit of this collective will of good that's kind of coming forward in this moment. We have more answers, we have more solutions, but there's still an opportunity for us to get curious and think differently. I hear my dad when I say this, but a road would only be as wide as a horse's butt if somebody didn't start thinking differently. So we need to show up and help people think differently as well, though, right? And challenge things, because we know the science has kind of moved faster than our systems, and that systems are slow to change. So we have to meet that middle spot, which Ian, I love the words that you used earlier today as well. We have to be realistic. We have to be patient with each other in this moment and kind of work with each other with what we have to work with, while pushing just a little bit in the right ways to go, I know that's what we did before, but maybe is there an opportunity to look at things differently? And we know when we do that in a really impactful way, we have moments like we had just this last week with the province of Alberta actually recognizing obesity as a chronic disease and declaring World Obesity Day as something that they are going to recognize not just this year, but all years going forward. And that is a monumental win, even though that doesn't come with action necessarily behind it immediately and today. That gives us literally, my foot is in the door, you guys. We have the opportunity to continue working with Alberta, but also now we have language that we can take to other provinces and territories and go, this is happening and this is real, and there's empirical evidence to support this. Let's work together and find solutions that are kind of break down these barriers together. So that's where I see there's a lot of barriers, and there's not going to be one single solution. Just like obesity, there's no one cause and there's no one cure. That's going to be the same in these policy and systemic change moments. But if we keep going, don't take our foot off the gas, I think we are going to see a big change coming.
Love it. Not barriers, opportunities. We got this.
Absolutely.
Okay, so I'm curious. So we've talked about some of the challenges, but what do you each think success looks like in 5 years in this space? So Ian, let's start with you.
Oh, another good question. Yeah, I think I think about this from the angle of, like, I'm involved in a bunch of advocacy kind of groups. I interact with other advocates in other disease states, and so, like, comparing where we are with obesity to where other disease states are in their work, and I would love to be where some of those people are in their work. So, the healthcare and the elimination of bias and stigma and those sorts of things, and access to care. I want it to be improved. I don't think we're going to be, it's not going to be perfect in 5 years. We're not going to, that's not where we're going to be. But I'd love to get to the spot as an advocate, as someone who works with the community, where we're not fighting the way we are now, where it's accepted, it's understood that this is a chronic disease, that people don't have to fight to get, to have a proper conversation or to have access to treatments. That stuff is starting to happen a little bit better, so they don't have to fight as much. And for me, the work then shifts to more raising awareness, and so that more people can get access to those things, and kind of opening up more doors that way, rather than this fighting and arguing and having to, like, change policy. I'd love to in 5 years get to a point where we are doing less of that and more of helping people and kind of pointing them down an easier path.
Yep, that paints a beautiful picture. Love that. Sanjeev, what are your thoughts? What success look like to you in 5 years?
In 5 years, I have a 15-year goal, but I'll go to 5 years. But for 5 years, I would say, I make parallels to what we had to do with mental health in the course of my career.
Mm-hmm.
And I would say, if people might recall, 20 years ago, it was hard to believe that depression was a health condition and it wasn't all in your head, right? Or a sign of weakness. And I have witnessed over the last decade a slow movement. So my 5 years is building on hope is my theme. But I would say I've seen some small movement to recognize that obesity is not about individual willpower or lack of willpower. It is not about eating less and moving more. but that it is also a chronic disease that requires medical attention. And so in 5 years, if we can accept across the country that this is a chronic disease, I think that would be success to me, because that opens the doors for now all of us to take all this tools. We know that Obesity Canada has competency frameworks for training the next generation of healthcare providers. We could start our whole medical schools, nursing schools, you name it, to inoculate them with the actual evidence that's been around for 20 years, to be able to have a healthcare workforce that doesn't question, to what Ian's saying, is obesity a real thing and should I be treating it? So, and probably more importantly, I just want to say that as healthcare providers, we want to do the right thing. And I think there's a lot of fear that we have, that we don't have the capability to unravel this messy ball that Lisa talked about of complexity. And so if we can provide that confidence and empower healthcare providers to join patients in their journey, in terms of treating obesity, and we can have this unified approach where we no longer have to, there's disbelief about obesity being a chronic disease, that to me is success in 5 years. So I have a lot of hope on it.
I do too. And now I want to know what your 15-year outlook is. Like,
Be careful what you wish for.
Yeah.
okay, maybe. All right. So, Mega, what are your thoughts for you? What are you looking for in the next 5 years as success?
Yeah, I mean, I'll reiterate what Ian and Sanjeev has said, but the way that it manifests for me is I hope that I have the confidence that when I send my patient out into the healthcare system, whether I'm referring them to a respirologist, a surgeon for their knee, it doesn't matter who my patient's going to see, that they're going to be welcomed, there's a space for them, and they're going to have the same conversation that I was able to have with them in my office. And we're not going to have this antagonistic, sort of conversation where the patient only feels well supported in one environment, but the healthcare system's not made for them. If in 5 years we could all just be having that same conversation and offer the same standard of care that we would for anyone else, for those living with obesity, I think, that would be music to my ears. And to the same point, if we're able to accomplish that, then my hope and belief is that manifests in every aspect of society, whether it's an airplane or getting on the bus or, all this different areas that people don't feel like are made for them and they don't belong in. I hope we can be the examples in the healthcare system to then show society kind of what that looks like.
I love that. And we're already seeing sprinkles of it. Like, I was just watching the show, I don't know if you guys have seen it, The Pit, and they had a recent episode around weight, stigma, and bias that can happen unconsciously in the emergency room. And I'm like, okay, that's amazing. We're sprinkling this in. It's now part of the dialogue. Things are changing. So, Lisa, what are your thoughts? What does success look like to you in 5 years?
I love this question as well. And I think it's really interesting because I think if we all looked over our shoulder and went, okay, 5 years ago is 2020, that feels equal like a heartbeat and also a lifetime, right? When we think about what life looked like in 2020. So again, that to me just paints a picture of nothing but opportunity. And what I hope success looks like, or where we're tracking to in 5 years, is that the conversation looks really different, and that people we're in a different space in talking about this altogether as well, that we won't have to have these same conversations where it's about the person that needs to change and we're really focused on the systems that need to change. I think that alone would be a huge win in 5 years. And then we go from there and we keep building. But I truly believe it is entirely possible.
Me too. That's awesome. Okay, so we have another poll for the audience. So we've talked about what needs to change. We want to hear from you about this. So what do you think, after hearing the conversations this week and this discussion today, what do you think is the most urgent step or next step in advancing obesity care? So we've got a few options: federal policy recognition, increased access to treatment, training for healthcare professionals, public education campaigns, or other, and type your thoughts in the chat. So we've got some polls hopefully starting to roll in soon. Oh, good. It's coming in. Thank you for your participation. Increased access to treatment, 100%. Training for healthcare professionals, yeah, 100%. I've heard many folks in the system say that they aren't really educated on this when they go to medical school. So wouldn't that be a beautiful thing? Yeah, federal policy recognition absolutely gets into coverage for medications and things like that. Beautiful. Gosh, okay. Love to see the participation. Thank you, everyone. Okay, so we have some time to talk a little bit about some of the questions that have been rolling in. We've had some really good questions in the chat, and Talia, behind the scenes, our expert, has combined some of the questions into some common themes so that we can answer as many as possible. So this is a really good one. I think Sanjeev and Mega, this one could maybe be directed to either of you. So you tag who's it. So it is, how can we start the best conversations with people in our lives, including healthcare practitioners, to get away from the negative stereotypes? I love that question.
Yeah. Maybe I'm going to toss it to you only because I think I've been answering before you in the previous segment. So you wanted your chance to go first.
Sure. Yeah, so let me clarify. This is a patient who's asking how they can clarify with their healthcare provider about how to engage in this conversation. Is that what you meant?
Yeah, how to best start those conversations. So invite
Mm-hmm.
people in to have the positive conversations and getting away from the negative stereotypes. So I think they're
Mm-hmm.
trying to invite people in, call people in, as opposed to calling people out, perhaps. What are your
Yeah.
thoughts?
Yeah, honestly, in this kind of position, I would say sometimes asking is more effective than sort of telling or sharing. Asking the idea that, I've been hearing this idea that obesity is a chronic disease and I'm struggling with my weight. What does that mean? And what does that mean for me and my health? And can we talk a little bit more about this? It's the same thing as asking permission, but sort of in a reverse order. It's can you help me better understand what I'm hearing, which is, oh, maybe this isn't my fault, and maybe there is some other treatment out there that I haven't tried. And I think to Ian's point, it's that the openness to know that maybe the person you're asking doesn't actually have the tools to help you. And that's okay because we're all in this space kind of learning together. And so it's the understanding and the patience to know if this isn't something that you're comfortable speaking with me about or that you're interested in engaging in, can you send me somewhere else? And I think just advocating for yourself to say, I need answers to these questions. I know someone out there can help me. If you can point me in the right direction, then that's I'd be more than happy to kind of engage in that way. And then what I think is probably the most important step here is circling back. Because if you've had a conversation with somebody who isn't able to help or doesn't understand the answers to the questions, and then you come back to them learning what you've learned and help them understand kind of where information could be and what you learned and what treatment meant for you, that is pivotal because now you've taken someone who didn't understand or wasn't open to the conversation and just push the needle a little bit in the right direction to sort of say, oh, maybe there is something I'm missing here that I can do better on. In the same way that somebody may refer a patient to me to speak about obesity, and they'll have not had a single conversation with the patient. They'll just refer to me and say, I don't want to talk about it. It's someone else's job. It's my job to then communicate back to that referring doctor and explain all the different things we talked about, why obesity is a chronic disease, empower my patient to then go back to their family doctor or the referring doctor to talk about what we've talked about. And now we're closing the loop and trying to move the needle forward. So I just sort of say, you're not alone here. The idea is not that you need to figure it out on your own, but I think it's okay when somebody doesn't have the answers because other people might.
Yeah, I mean, I'm gonna, for the sake of time, I agree completely with Mega, and I might just add a small piece to this that I do think there are opportunities to leverage the fact that you attended this session here and have these resources that sometimes as part of that conversation, as Mega talked about, and bringing this forward as a question, and open that discussion to discovery and exploration jointly, that you can also bring in to say, like, I was at this, patient education seminar and I heard about this. That might be another context. And Obesity Canada does have some information that patients can bring forward to healthcare providers. And so those might be some of the tools and toolkits that you might bring up to the second or follow-up conversation that Mega alluded to as well. And likewise, I also find that sometimes some of my colleagues who don't work in this space may not know even where to refer. And so looking at clinic locators or resources in your region might be helpful as this joint exploration and trying to help someone like a healthcare provider who might not be familiar with this kind of problem solve with you on the spot. I think that curiosity and that exploratory approach can be really quite helpful to engage, because as I said at the beginning, we're all unlearning and relearning as part of this journey.
Absolutely. And I think reading between the lines in some of these questions here, from a psychological perspective, what would you say to a person who, they have had really great conversations with practitioners and clinicians who are familiar with the practice guidelines. Things are going well. They know now it's not their fault. It's a chronic disease. They're getting care and they have unpacked that internalized bias, etc. But they're met with family members or friends who are still perhaps living in a world of diet culture and the old rhetoric of eat less and move more, and that obesity is a moral failing, perhaps an internalized thought that they may have that they don't even know subconsciously. What support can you offer maybe folks in having conversations with the people in their lives? Because we know community is important, but we also know that's really frustrating. Long-winded question, but from a psychological perspective, Sanjeev, what are some tips?
Yeah, I think the first thing is to be aware that bias is prevalent in our society. And again, someone who's done that work to really address and articulate some of that internalized bias, as they're met with it, again, it's quite natural for it to try to permeate back internally to an individual. And I think the first is to be aware of the work that someone has done with the person in front of you, whether it's in the household or at a family gathering, and these comments or these behaviors come forward. I think one of the things to think about is, it may be an opportunity to have a discussion with the individual. Well, have you heard a little bit about, what's been happening in obesity and some of the work? I think about Lisa and talking about Alberta as a chronic disease. Well, do you realize there's changes happening in our society right now? There's, Alberta has adopted this as a chronic disease. There are new guidelines out there, and you're still going to be met with people who are in disbelief, who say, no, I think it's about willpower, or all these stigmatizing types of these comments. And I think as part of that is, it's hard similar to a healthcare provider, to tell someone and change their ideology in one encounter, right? And that should never be put on any one individual who's gone through their own recovery journey as part of engaging in treatment for obesity care. So I would encourage people to start to think about what are the small wins or moments for education that might come up. And for some people, it might be helpful to bring in an ally or support who is part of your support network, who already gets what you're doing, so that they can be there to also have that conversation with you, because it's hard to put on one individual, especially in a larger group setting. So sometimes I've had individuals who've brought in their loved one who's been on that journey with them, who've also been on that education awareness journey in those contexts, and being able to tangibly make those small moments. And then lastly, I'll say, sometimes you also know when you have to remove yourself from those situations, because no matter what you say, you're met with this. And that is not something we want individuals to have and endure on their own. So it's about knowing the limits of where you can start to increase and inject some of that awareness, that exploration, and if there's a door open or a little crevice open to do information sharing, to give a little bit of information sharing and see where that sits. And it may sit It may sit there, it may get closed again, and then you've done your job for that day. And know that it doesn't fall on you alone. And maybe this is why this connected community is so valuable, because all of us doing those little open and close moments can really maybe push open or slam open that door eventually for some individuals. Yeah.
I love that. I want to build off that just for a second, if I could, because I think, in those real life interaction moments when they're sometimes happening very quickly, or it could be, let's be honest, I don't think I've ever had a pedicure where someone didn't try and talk to me about my weight even. Like, you get it from these very odd spots as well. And I think it's a real opportunity for those of us living this moment to just really encourage people to invite curiosity and go, that seems, oh, I have different information, or there's other things to consider now, and really make it a human moment. Because I had the opportunity to hear Tim Caulfield speak at a Together Against Misinformation event, and he was saying, it's interesting when you look around and you talk to your friends and your family, ask them about how many things they have changed their mind about something. It could be anything, but how are they about changing their minds about things? And that's a really telling moment. And if you've got somebody who can't say that they've changed their mind about something in the last 1 or 2 years, that's kind of a big red flag, everybody. And that might be one of those people we don't engage with them that same level. But if they can think of moments where they've changed their own thinking about something or seen something different, and hello, the world's crazy, so I think we've all had to change our thinkings on a few things in the last few years, that's even an open door to put your foot in and kind of go, you could change your mind about that. I wonder why you can't change your mind about this one. And that invites that invitation to kind of think about their own bias and the limitations, because we were all told a pretty big lie with diet culture that has a really big budget. So I anchor back to what Ian said in the beginning as well. We need to have grace and give space to all of us to kind of go, ooh, that is different. I need to think about this in a little bit different of a light. So I think just even inviting them, as I know, Mega, you're fantastic at that in those clinical settings. I think we can do that in really public settings as well, and just invite them to be a little curious and go,
Yeah, and
think about
I
it.
think, like, just again to build off of everything that's already been said, I kind of I'm thinking about how I personally changed the way I spoke and started using person first language. That was something that came into our space and that we started using several years ago. And when it first started happening, it was very it was hard. It was difficult to make that change, right? Like the language that we use is so ingrained and so natural. So like correcting myself. But I found that even just speaking that way and using the right language sparked interest in the people around me, and like with my family members or with friends and stuff like that. And it doesn't need to be something where I'm like making it a lecture or something. They just hear how I'm saying. They're like, wait, that's different. And then they start listening to what I have to say a bit more. Maybe they start asking me questions. That could be even a way of just opening a door. So the way I look at it is like, I'm pretty confident in what I understand and what I know about this space and what I talk about when it comes to obesity. I don't let like instances of bias or things like that I see or that I come across, like fat jokes or things like that. I don't let those go. I always make sure that they're checked in some shape or form. It doesn't have to be an aggressive kind of, I'm going to start a fight here. But I correct it. I say something or I make a comment. And if it's like something that just gets left alone and we go on, or if it's something that sparks a discussion, that's fine. But I'm consistent in that. And that consistent use of the right language and speaking the way I speak has pulled people into the conversation and pulled them into reaching out to me and saying, hey, I'd like to learn more. Or, hey, can we have a chat about this? So I think that's a big part of it as well.
Absolutely. We don't walk around saying a cancerous person or a diabetic person. Why do we go around saying an obese person, right? It's a person living with obesity, or a person living with overweight, or a person living with mental health. Like, we're all people first. A thing that's really helped me in my life is sharing, like, oh, I read this really interesting book, What We Don't Talk About When We Talk About Fat by Aubrey Gordon. Love that book. And it's, someone might say, okay, why did you love that book? And I say, oh, I for these reasons. Do you want me to lend you my copy? And then if they read the book, you can say, what did you think about it? Things like that. So I think it's
Also,
it's
just
being
a mini shout out, Lauren. Her documentary, Your Fat Friend, is available on CBC Gem for free. So
fantastic.
everybody should check it out.
Everyone watch it. She's amazing. She's my hero. Okay, I'm just cognizant of time. So I'm going to ask a question that is a good segue into wrapping things up. So, Ian, how can people with lived experience get more involved with advocacy and public policy if they've been inspired this week?
That is a great question. We've got lots of stuff coming up. So I think, first and foremost, join our community. Our OC Connect community is a big piece of this, and it's going to become an even bigger piece as we start going forward here. So join our OC Connect community. There's information in there that can help empower you. We have an advocacy course in there. That's some online modules and those sorts of things. And then from there, we've got things that are going to be ongoing, like petitions and letter writing campaigns. And we're going to start having more of these advocacy pushes. So making sure that you're connecting with myself or with us in the community, those opportunities are going to come up, and we will make sure that we start creating that action that we want to.
Amazing. So I'm going to wrap up by saying a huge thank you to our panelists. This was so much fun. I think we could have kept going for hours and hours. I mean, I'm still curious about Sanjeev's 15-year vision. So we could be doing this for hours, but this is great. Thank you so much for your participation today and for the work you do in this important space. So folks, audience members, we've talked a lot about the need for change. Now let's talk about what you can do. Ian talked a little bit about this, but we want you to be a part of this movement. So momentum is powerful, but it's only powerful if we act on it. Obesity is a chronic disease, and it's time we treat it like one. Unfortunately, despite overwhelming scientific evidence, obesity is still not officially recognized as a chronic disease in many parts of Canada. This lack of recognition fuels stigma and limits access to proper treatment. So we're delighted to celebrate that Alberta is the first province to recognize obesity as a chronic disease. So shout out to our friends in the West. Now, the rest of Canada, we need your help. That's why we're asking every single one of you to take action today, and please sign the petition to urge your provincial and federal leaders to take action and ensure people living with obesity get the care they deserve. You can access the petition by clicking on the link in the chat or on the screen here. I believe, yes, we have the information. So please just take a moment, sign the petition, send a letter, spread the word. This is how change happens. Even if you want to share some of the conversations that you found interesting this week with your friends and family, we would love that as well. So, if you want to go far, go alone. If you want to go fast, go alone. If you want to go far, go together is what I'm thinking about today. So to wrap things up, I think let's just make this happen. Thank you all for being here. To support the mission and get involved with research, education, advocacy efforts, eliminating weight bias, and expanding access to quality evidence-based informed care for Canadians as the heart of our work. So there are many options to choose from for how you can make an impact and help improve the lives of folks living with obesity. Please make sure, if you haven't already done so, to check out the OC Connect in our online community to keep the conversation going. OC Connect is our private online community. It's safe. It's designed for people with obesity. It's a place for peer support and evidence-based education and empowerment. So now let's go. Take action. Thanks, everyone.